everyone. I'm very glad that we meet here again, and I would like to recognize the presence of everyone from different schools, from different hospitals, and some of my friends from other DOH hospitals were here. Dr. Maurice and Dr. from Reyes, both of you, yes. So to start with, I will be talking about dental needs of special people. So not only autism, but special people. We have categories of special needs patient. So I will be mentioning that later on. What are the objectives of this lecture? First of all, to determine the dental needs of special dental care of SNP or special needs patient, to learn the dental clinical approach or management of dental needs patient, to learn when to start seeking dental attention of SNP, and how to maintain good oral hygiene of special needs patient. When it comes to dental kasi, even if it is not special, we go to the dentist only if there's pain. Diba? Yan ang mga typical patient, typical Pinoy. Pag may sakit, saka napunta ng dentista, minsan magana. Tapos pag in-appoint naman, late pupunta, mga ganyan. Tapos, next please. Who are special? Special needs patients defined as any physical, developmental, mental, sensory, behavioral, cognitive, or emotional and speech impairment or limiting condition that requires medical or surgical management, healthcare intervention, and or use of specialized service or program. Patient with compromised immunity. So in short, mga special needs patient not only with behavioral like autism, but patients with medical condition that inhibits them to function normally. Katulad ng mga cancer patients, special needs patient yan, mga handicap patient with disability physically. So yung mga naka-wheelchair, mga heart patients, mga from children to adult, anyone with medical and physical impairment or disability that inhibits them to function normally. So in summary, what are the disability? Physical, so that impairs them, impairment to the mobility or respiratory. So yung mga mayroong amputated leg result to diabetes condition, karoon ng amputation. Respiratory, like yung mga like COPD, mga ganyan. Mental, emotional, like autism, ADHD. Sensory, like yung mga hearing impaired person. Visual, like blind person. And cognitive, learning or LD, learning disability and attention. What are the barriers that faced by special needs patient? Language barrier. Of course, this patient, specifically autism, they do not complain. May mga sakit na ipin, malalaman nila ng family, ay, ba't hindi siya kumakain? Parang iba yung itsura ng mukha, mas malaki yung kabila, magana pala. Autism patient do not complain of any pain. Malalaman na lang yan ng family or parents na there's something wrong, patient doesn't eat. Or yinangat-ngat na lang yung kurtina, may masakit pa lang ipin. I will show you cases na autism. And then sensory impairment, of course language barrier, yung mga mute, no? Yung mga nagsa-sign language. Minsan nakakapunta naman sila ng dentista, but the problem is, paano yung dentista hindi marunong mag-sign language? They cannot still treat the patient. One good thing, I can do sign language din kasi I am SPED also. So a little. So that's why pag may mga mute patient or we do sign language. If there's pain, so I will do extraction. So yun lang naman yung barrier pag sa language barrier. Sensory impairment such as vision and hearing problems. So hearing problems common sa mga Alzheimer disease naman. Meron silang hearing and a little of mental, and then vision, yung mga blind. May mga syndrome kasi na blind. And then I will show you also a case like that. May mga syndromic, kasi when you say syndrome, it's a combination of many diseases that are results to a certain condition that sometimes pupunta lang sa iyo for that particular condition, but the in general health of the patient, combination of many diseases. Psychosocial issues such as low oral health literacy, dental anxiety, and past negative experiences. So, ang family kasi it's not aware of the oral health or dental health of the patient, hindi yan dadalhin nga sa dentista. Kasi nga, first of all, may mga clinic na, yun nga, they are not properly trained to treat those patients, and then they will ask them to go to the hospital. So if that is the case, the family of that patient will not go anywhere anymore. Antayin na lang. So marami akong first time autism patients, minsan at the age of 42, first time to see dentist pa lang. Limited transportation, wheelchair ramp, disabled parking spaces. Ayun yung sinasabi ni Ma'am kanina. There are some, may mga limited lang ang mga areas, even restaurant nga, na may mga ramp for disability patient, special needs patient. Tapos kung sa ospital naman, ang doctor's clinic nasa second floor, wala naman palang elevator going to second floor. Minsan makikita mo may mga hospital na gano'n, inaakyat yung wheelchair through the stairs. Dental offices that are not wheelchair accessible, cultural barriers such as healthcare providers with little training in cultural competency and treating patients with special needs. So, if the doctors or if the dental facility is not aware of not properly trained in treating special needs patient, minsan may tendency, ikaw na dyan, kaya mo na yan, ikaw nang bahala. Parang may ganong culture. Pero if you are aware of, familiar with treating all those patients, you will talagang you know how to approach from the beginning. First of all, ang autism, when they go to the clinic, dapat ang dentist walang mask. No? Kasi usually, mga dentist may mask agad. The autism should look at the face of the dentist from the very first time. Kasi kung nakamask ka na kaagad, hindi na yan tutuloy going to the dental chair. Sa entrance pa lang, hindi na. Strategies to overcome barriers. Provide education and networking resources to oral health professionals who serve S&P. Provide training for parents, family members, caregivers on how to perform appropriate oral hygiene. And lack of training may result in unwillingness to provide treatment to special need population. Of course, in any special needs patient, no, kailangan talaga dapat well support ng family. Okay? Especially for the child. Kasi the first talagang caregiver of the child, of the special need patient child is the parents. That's why kasama sila sa mga patient education and how to do proper oral hygiene. Kasi meron silang lack of dexterity, how to perform it. May mga improvisation on how to use those mga oral hygiene. Special Care Dentistry is a unique international organization of oral health professionals and other individuals who are dedicated to promoting oral health and well-being for people with special needs. In the US, it's a combination of Council of Hospital Dentistry, Council of Dentistry for People with Disabilities, and Council of Geriatric Dentistry. So meron silang mga focus, no, ng mga special needs patient. Kasi sa adult kasi, mostly mga Alzheimer's disease, mga physical debilitating or medically compromised, and then hospital dentistry, mga cancer patients, and then people with disabilities, ito na yung mga mental and behavioral. So for now, in the US, they combine the three council and they form na nga special care dentistry, and I was lucky to be one of them. Last 2007, I was able to show and to share my experience and show one of my cases in North Carolina 2017, and then in Georgia 2019. So I share it to them with my colleagues, with other special care dentists. Medyo konti lang talaga. Kasi, well, honestly, mahirap talaga mag-treat, no? Pero when you were able to do your duty as a dentist for those kind of patients, it's really fulfilling. Pero kukunti nga lang. Sige. This is Leo Kanner that Dr. Covey mentioning a while ago, published a case of 11 or 12, autism disturbance of effective contact. First time to use term autism, clinical group of children. You mentioned a while ago that cold parents, no, one of the cause of autism, and the term first time I encountered this term parentectomy. They remove the mother from the children who are na suspected with autism. So the doctors, yun ang treatment ng doctors, they remove, pinapahiwalay muna yung magulang. Doon sa bata, yes. Tapos yun ang pinaka-treatment, and then eventually meron namang improvement. So ito, okay, next na lang. Dr. Kobe already explained very well the autism. So a little na lang. Obsessive routine, yun na lang. Yan. Version, unpredictable body movements, and self-injurious behavior can affect dental treatment. Kasi kung first time talaga, minsan reconditioning muna. Okay, kasi meron silang mga behavior that can limit the dental management of the dentist and quite injurious kasi yung dental chair, meron yung light that pwede nilang matamaan, tapos yung mga sharp instruments that can really hurt them. So, may mga technique kung paano yung initial appointment and then yung followed up appointment. So, in summary, autism is composed of social deficit, language impairment, repetitive behavior. So, composed of intellectual disability, and other factors can be considered like sleep deficit, mood, anxiety, hyperactivity, sleep disorders, mood disorders, and ADHD. So, may mga pasyente rin ako na autism na not only autism but accompanied by other medical conditions. So ito yung mga approach, no? Even if it's not autism, for child, high speed, kasi may ginagamit kaming mga pangpasta, medyo masakit sa ulo yun, di ba? Pag bata, so sensitive to tooth polishing, we make use of, instead of manual scaling na lang. You can do manual scaling instead. Tapos, listen to a favorite music, of course, headphone, guardian to deep pressure. Sometimes yung deep pressure, you have to a little bit press the jaw, no, to make lang the child feel na she is secure with you. Dental chair hanging, changing position, inform patient of what is about to happen. Use picture and visual schedule. I will show you a visual schedule. Taste of polishing Profi paste. Give patient a choice of, marami kasing flavored kasi ang polishing paste. So after manual scaling or deep scaling with the machine, merong ginagamit na Profi paste, parang toothpaste lang siya with adhesive kasi yun. So may mga flavor yon. You can ask the patient which flavor does he want. Dental light is too bright, of course, wear dark goggles, may nakaprepare naman. And then reactive gag response. Ako kasi, yung mouth mirror kasi namin metal. So when I insert the mouth mirror, I will ask the patient to open wide talaga. And then I will return the mirror lang without touching the tongue, the buccal mucosa, the palate. Kasi if the patient feel na merong something hard, it will close. So yung mouth mirror, ipaikot mo lang siya doon para makita mo lang kung meron bang sira yung mga ngipin sa taas and then show lang the upper teeth. But don't touch lang the buccal mucosa, the tongue, or else you, there's something hard inside my mouth, and the patient will close the mouth. Overreactive gag reflex, and then generalized noise. Of course, ayaw talaga nila ng maingay, pero pwede silang makinig sa favorite music nila. And then allow child to bring favorite toy. Meron silang comfort toy na tinatawag. Allow child listen to a calming favorite music and short appointments. Usually initial appointment consult lang. And then show the child what are the function of yung mga things na gagamitin. Okay, next please. So basically these are instruments I use in the OR. So before ko kasi pa-instrument, this one, the one like a mouth mirror, like a scissors, yon, parang gunting siya. Yan ang lagi kong gamit to keep the mouth open. That is a mouth prop to keep the mouth open. Siyempre, pag general anesthesia, close lahat. So, to keep the mouth open. Okay, next please. So, this patient is a 9-year-old girl. History nito, the parents really wanted, to have a baby. After 2 years sila nagka-baby. Okay, itong baby na to, talagang long-waited itong pasyente na to. So, very happy naman. Unfortunately, both parents are working and then naiiwan sa yaya si baby. In 6 months old, nahulog si baby ng yaya. Nagkaroon ng tubig ang ulo. Hindi alam ng mother. So, nalaman na lang ng mother when pinaliliguan the baby, something bulging dun sa ulo and so pinalis yung yaya. So, in 2 years na-detect siya with autism. I cannot tell that the fall of the patient that causes the autism. Of course not. But, the mother also thought na yun ang dahilan. So, marami kasing factors eh. And this child is really something unique because her favorite food, kasi ang autism, meron silang mga rituals, no? May mga rituals silang ginagawa. Her favorite food is hamburger. But before she eats the hamburger, she will remove the tomato, she will remove the lettuce, she will remove the patty, she will remove the cheese. So may iwan yung bun. So yun lang kakainin niya. Ayun. So the mother tried actually gave her a bun. Gumawa siya ng bun. But the child doesn't want to eat the bun. Oo. Gusto nila may ritual siya. Mga ganyan. So anyway, I extracted 8 teeth and 6 restoration in the OR. Okay, next please. This one is my eldest actually, at the age of 42. She, first time niya to see a dentist. Sabi ko, Mami, bakit ngayon nagpunta ng dentista? Kasi simula bata, wala namang masakit. And then, mahirap siya dalhin kasi malaking talagang bulas siya. So, hindi na siya nadala. So, anyway, yung ngipin niya doon sa, itong ngipin na to, actually, hindi ngipin niya ganyan kalaki na yung tartar niya. So, that bulky. So, imagine yung 42 years, naipon yung dumi ng ngipin. Di ba at the age of 3, nagpapadental na tayo, di ba? 3 kasi kumpleto na yung ngipin niya at the age of 2 eh. So, naalagaan na siya, nagpapadental na yan, and then every 6 months, nagpapadental. But for him, at the age of 42, to see a dentist. So, I did multiple tooth extraction, restoration, and oral prophylaxis. So when you do na extraction, you also do na alveoloplasty. So pagka nabunod mo na lahat ng ngipin, medyo pantayin mo na yung buto, and then you suture it na. And use absorbable sutures. Because pag nagising na yan, hindi nangangangayan ulit. Okay, hindi na yan nganganga ulit. Kaya maintenance na lang. Kaya make sure the sutures are absorbable. Okay, next please. This is with Dr. Cove. You remember when I visited you, we went to Columbia University to attend the forum of autism, and it was mentioned there that before the discovery of Dr. Kanner of autism, it was already existing na talagang autism. It's just that nobody's still making a research on that. It was really a great experience. And then visual schedule, along with repeated weekly visits, showed some promise in helping children with autism successfully complete more steps progress at a quick rate and exhibit lower levels of behavioral distress within a dental appointment compared to a traditional tell, show, do approach from the Journal of Clinical Pediatric Dentistry. So dati kasi nung college tayo, tell, show, di ba pinapakita natin, this is the lights, show, tell, show lang tayo. But ngayon may visual schedule na tinatawag na. Next please. The visual schedule is like this. So kailangan pakitaan nyo siya ng picture. Pupunta tayo sa clinic ni Doktora, and the clinic is inside this building. So may picture na, para na napoprogram na sa utak niya. Kasi autism kasi is something meant neurological, diba? So kailangan napoprogram na yung brain niya na we're going to this building. And that building is inside, the clinic is inside that building. Next. And then, you will sit on the dental chair. You can put the name, let's say Peter will sit and relax on the dental chair, and the dental chair will show you if it is the chair, to demonstrate yung chair na up and down, back and forth, yun. And then, sit on the dental chair with wear glasses. So yun, papakita mo rin. May picture talagang ganyan. Some parents, nilalaminate yan para nakakita, ito na yung gagawin ko next, ito na yung gagawin ko next. And then open your mouth wide. Okay. And then something will go inside my mouth, like the mouth mirror, and then the explorer, tooth counter, and then the prophy paste and the brush. So at least pag ginamit ng dentista, alam na ng pasyente na, nakita ko doon sa picture. Ito yung gagamitin sa akin exactly. So nakaprogram na sa mind ng pasyente. Okay, next. So this is what I use in my clinic. So I make parang one sheet lang siya na pwede naman i-laminate. So your next visit will be, nakalagay na yung date. Aabangan na yan actually ng pasyente. So especially for autism, because very, very particular din sila sa mga dates. And then, like Peter, it is nice to see him. How are you? So sabi niya, kaya pag nakita ni Peter yan, badating sa clinic, hello! Kasi nakita niya na may hello. Okay? And then come, let us visit, and then pupunta na yan agad sa dental chair. Kasi nakita niya na yung dental chair eh. And then pag dental chair, ilalabas niya na yung goggles niya, ilalabas na niya yung headphone niya, and then di mo pa sinasabing mga nganga na yan. Hindi madali na yung trabaho mo, no? Bilang dentista, ilawan mo na siya. Tapos, and then yung mga first time, yun, kailangan mo pang sabihan ng count to 1 to 3 to check your teeth, and then explain mo bakit mo nililinis, and then show the itsura ng bacteria, pangit, and then the suction tip, okay, on the left side, and then floss, yan. So, with the thumbs up, pagtapos na. And then, pwede niya na ulit iuwi ang visual schedule. Okay, this is another special case, Marfan syndrome. Marfan syndrome is of 5,000 people have Marfan syndrome, including men and women of all races and ethnic groups. About 3 out of people with Marfan syndrome inherit it, meaning they get it again through genetics. But some people with Marfan are first in their family to have it, and there is a 50% chance with pass along the genetic from the Marfan Foundation. Okay, next. Okay, actually there's no test for Marfan syndrome. There is no even X-ray for Marfan syndrome. Mga features lang yan. Okay, may mga features lang yan. So for Marfan syndrome, Steinberg sign. If you do like this, for us regular people, hindi lumalagpas yung thumb, diba? Pero when you do it, pag yung thumb lumagpas na sa ganyan, ito kasi pinipilit ko diba? So for them, pag lumagpas na yan, that's Marfan syndrome. Kasi mahahaba yung extremities nila. Okay? And then your wrist, so kung ito, yan, lumagpas din dito. So that is Marfan syndrome. Kasi nga, again, mahaba yung fingers and the extremities. So that is that special feature of Marfan syndrome. Okay, next. And this is my case. Meron siyang mass on the upper arch for 8 months. 35-year-old male, upper arch, sometimes it tastes like blood. Basta magbi-bleed na Had a consult, no allergy, no hospitalization. At the age of 12, there's a weak vision. At age 28, blind na siya for both eyes. And loss of vision at the age of 29. And her height, ayun, high school graduate. Okay, next. Okay. Ang Marfan syndrome, kung halimbawa, height mo is 163 centimeter, ang sa Marfan syndrome, longer. The measurement for your left hand to your right hand, mas mahaba dun sa height. So bilateral blind, there's a pectus carinatum. So yon. So yung medyo bulky yung kanyang pectoralis muscles and bone doon. Next please. Ayan. Medyo protruded, that is a pectus carinatum. Okay, next. So intraorally, there's a 2.5 by cm. So this is 1 cm actually, and this is 2 cm. So 2.5 mga ganyan kalaki. Okay. Moderate calcular deposits, multiple root fragments, and carious teeth. So when I remove that lesion, the result is pyogenic granuloma in patient with Marfan syndrome. Okay. Next. As a SPED educator, kasi nga SPED educator din ako, I combine with my experience and knowledge in applying it to my special needs patient. I crumple the paper. Sinlaki ng munggo, sinlaki ng peanut, then sinlaki ng Holland, and then sinlaki ng jackstone. And then syempre kasi yung patient, for us doctors kasi, whether dental or medical, we have to get a complete history of the patient for you to come up with the correct diagnosis and therefore correct treatment. So, hindi alam ng pasyente kung kailan nag-umpisa yung bukol niya. So sabi ko, nakapikit siya, pinifeel niya, pag ganito ba, mga ilang buwan na feel mo, mga ganito siguro mga 2 weeks ago or 2 months ago. O nung ganito nakalaki, nafe-feel naman niya. As in, laki ng peanut, mga 1 month ago. Ganito nakalaki, so 2 weeks ago. So through your modification as PED teachers, now you will be able to get a good history. So in 2 months time, in 3 months time, sinlaki na pala siya ng kalahati ng jackstone. So mas malaki pa sa Holland. So ganon. Ganon kalaki yung lesion niya. Kaya pala, nagdudugo kasi nakakagat niya. Kasi nga malaki na yung lesion. Malaki na yung mass. And of course, there's no dental clinic who wanted to do the procedure. Kasi nga, pagka nalaman na may syndrome, ay maraming sakit to, ayoko muna. Sa hospital na lang, punta na lang sa hospital. Yun ang normal response. So, I remove the tissue and then inside the tissue is a multiple root fragments. Kasi ang pyogenic granuloma is caused by trauma and poor oral hygiene. So kung marami na papilar deposit at mga upod ng ngipin natutrauma, so the tissue proliferates, lumalaki. So tinanggal ko na yon using the cautery and of course the blade and then suction. Okay, next. So 1 week after, ayun na siya. And then actually, nagko-contact na kami, ready na siya for dentures. And actually, he is a blind massage, ha? Nagba-blind massage. Yun ang kanyang work ngayon. Alzheimer's disease is a irreversible, progressive, retrogenerative condition and the most common form of dementia. A term that describes group of symptoms affecting memory, social abilities that affects daily life. It is unknown but is believed to be multifactorial. So, maraming cause ang Alzheimer. Multifactorial, not caused by not only medical but environmental. So, pag nagkaka-age kasi, kailangan talaga na active pa rin yung brain. So, you read, you go out with friends, you do activities, or else, yun, magkaka-develop ng Alzheimer. Familiar ba? Yung nasan yung salamin ko? Yung pala suot mo, no? Yung mga ganong factor. Suot pala, nandito sa ulo. Okay. No laboratory test for Alzheimer, but there are common signs of AD. You have memory changes that disrupts daily life, challenges in planning or solving problems, confusion with time and place, trouble understanding visual images, misplacing things, change in moods. Okay, next. Other oral health conditions, decreased saliva due to medication. May not be able to communicate that they are experiencing compromise due to disorientation and more oral diseases. Of course, as we age kasi, habang tumatanda ang tao, yung bone nagre-resorb. Diba? Normal naman lahat sa atin yan. Pati pa nga. Kaya akala nila, oy, lumilit yung mukha ko. Hindi. Kasi nagre-resorb yung bone natin. In any part of our body, that's normal actually. Kaya nga, we cannot stop that, but pwede natin i-delay yan through proper nutrition, activities, etc. So actually, intraoral naman, Kaya they are very prone to periodontal disease. So periodontal disease is the condition kung saan lumalabas na yung ugat ng mga ngipin. Kasi nga, luminipis yung panga. Panga sa taas at saka panga sa baba. Lower jaw and maxilla and mandibular jaw. So, nagkakaroon ng periodontitis. Pag lumabas kasi o nag-show na yung root portion ng ngipin, medyo malapit na yung umuga. So, therefore, extraction na yun. So, yun ang periodontal disease. Next, please. Ayan. This is my kanina, eldest ko for autism. This is my eldest patient that I have handled. This is actually 3 weeks ago lang. When I asked the patient to smile para makita ko yung ngipin, sabi ko, smile. Sabi ng pasyente. So, ano siya, na-disorient siya kung paano bang itsura nun. So, well, for AD kasi, you have to show them also. When you ask them to smile, kailangan pakita mo smile. Ganon. Kaya para gagayahin ka niya. Smile. Minsan pag sinabi smile po, pag sinabi smile po lang, nganga lang niya, sabi niya. Okay? Hindi niya alam na ang ginawa niya is nganga, hindi pala smile. So smile, and then open your mouth. Nganga din siya. So ganon. Anyway, this patient is a retired dentist, 94 years old. So actually, wala siyang any medical condition. Sabi ko, believe ako, wala siyang any very tall man, wala siyang any medical condition. So walang problema. But when we are inside the OR, during the intra-op na, biglang nag-hypertensive. So probably it could be from the age then. Tsaka siguro undetect medical other condition that can contribute to that hypertension. So we deferred the OR initially. So lahat ready na kami, lahat ready na, pero there are condition na we need to defer it. So our team decided to defer the procedure, or else kasi pwedeng mag-trigger to another medical condition. The IM or the internal medicine people give a medication to lower down the BP, but the patient reaches the maximum amount of medication to lower the BP. Kasi hindi pwedeng lumagpas doon, or else baka mag-hypo naman. Mas mahirap yon na biglang mag-hypo during the OR. So, we deferred it, and then that is the second na. Next, we were able na, ayan na siya, smile, tapos ngumanga si Lolo. Okay. So, yon. Next, please. Ayan na. So, that time, on the second time, we were able naman to remove 9 teeth yata. 9 ba? Ayun. 1, 2, 3, 4, 5, 9 teeth. Of course, with abuloplasty and restoration. At siya talaga ang nag-request. Sabi niya, Doktora, gusto ko tulog ako. Ayokong pabalik-balik. Siyempre, di ba, pag may edad na, yun yan ang paulit-ulit. Kahit siya misma, siya yung paulit-ulit. So, ayaw niyang pabalik-balik sa clinic, so kaya siya nag-decide na rin na general anesthesia. And we were able na to remove everything. Then, babalik na siya ngayon sa akin for denture na lang. So, ito, grinding of teeth and loss of appetite. This is the complaint of autism patient. 1 month prior to consult according to the mother. Ito ang observation ng mother. Doktora, wala akong problema simula noon sa pagkain niya. Kaya lang, napuna ko lang, bigla na lang sumisigaw yan, at nanggigigil, at nakikita ko yung kurtina namin butas na, kasi ninangat-ngat niya. Yan ang parang tingin ko, sa ngipin yon. So, ganun kasi usually lang ang symptoms, kasi nga, the autism will not complain of any pain. So, napansin yun ng mother. So, sige po, in-explain ko, I explained very well the management of autism when it comes to dental. No previous hospitalization, no allergy, pero may ubo na konti, but not productive, walang phlegm. Tapos yun lang, meron siyang loss of appetite. At ang something na, ang tawag dito, remarkable, 1 month siya, mga 2 weeks yata siya hindi nagpupupo. And that is something, to get attention. Okay. So yun, alright. So, na-detect siya at the age of 5. Of course, may mga features. Okay, next please. And then, when binigyan ko na siya ng mga lab request, sana for OR na schedule. But, when the results came out and she gave to me the impression of chest x-ray, meron siyang pulmonary TB, pulmonary tuberculosis, and then look at the hemoglobin, it's 81 only. The normal is 120 to 140. So, sabi ko, I decided to call the attention of other specialty because that is anemia and that is TB na hindi pwedeng i-treat prior to dental. So, kailangan yan muna ang gawin. So, I referred it to the other specialty and patient was admitted. And then, next please, given medication upon admission for the TB. For a regular patient kasi, kahit walang autism, for us dentists kasi, before we treat the TB patient, at least nag-medication muna siya ng 2 months. Kasi the protocol of TB treatment, that is management kasi, di ba, they will take 6 months medication. So for us dentists, before to treat, at least naka 2 months medication. Okay, next please. Ayan, okay, next na. So this is the normal values that we recommend to TB patients. And then next please. So anemia is a common complication of pulmonary tuberculosis. So kung may TB ka, definitely you will have an anemia because of the cytokine production, nutritional deficiency, and malabsorption. Di ba hindi nga kumakain yung pasyente? So nagkaroon ng nutritional deficiency and malabsorption, di pa nga nagpupupo for 2 weeks, and then it results to anemia, suggest because of iron deficiency, cause of anemia with TB patient. So of course, may pale, may swollen, may cracks and soreness of corners of the mouth. Next please. So itong pasyente na to, kaya pala mataas yung kanyang infection, WBC. Kasi meron din pala siyang malaking pigsa sa hita. You can see the boundary of the lesion. Ito, ganito kalaki yung lesion niya. Because this is already 17 post-op. So nakikita nyo yan, ganyang kalaki yung lesion niya from there. Okay? So, yan kasi, naoperahan na siya. And that is already 17 days ago. So, our team composed of general surgery, IM, ENT, me, and anesthesiologist. Okay? So, nag-transfuse kasi nga may anemia. We did a transfusion of 2-pack RBC. Kasi nga malaki yung infection prior to surgery. Next, please. Okay, next please. So on the hospital day, we checked in with the ENT kasi nga hindi nagre-respond. Kasi naman kahit paano autism, nagre-response yan. But for that patient, yung pala meron ding impacted cerumen, both bilateral. So after I did the dental, ENT followed to do the ear. So extraction of mini teeth, 8 ulit or 9. Then procedure done. So, yun. Okay, next please. So, ayan na siya. During that time, may libreng gupit sa mga pasyente. So, bagong gupit yung pasyente. Pero kasing gano'n na yung mga libre-libre minsan. Ayan. So, that is before and now the patient post-op. Ayan, next please. Ito very distinct to. Every time she comes to me, lagi lang one ang kasama. Only the mother. Siguro mga 6 months, no? Na follow up and then they decided magpa-OR. And then during the OR, meron na nakuhang room. Lagi yung kasama niya. Sabi ng mother, Doktora, gusto ko po kumuha ng mas malaking room. Ay, hindi po kailangan kasi pag autism, ay always admission lang, na-hospital lang siya for 2 days and then discharge na. As soon as I finish the procedure, on the 2nd day, discharge na. Kaya lang, I need to stay in the PACU, post-anesthesia care unit. You have to stay in the PACU kasi once the patient woke up, they will remove all the tubing. So very important na stay kayo kung hindi tatanggalin yung mga IV, lahat. So kailangan maintain. Anyway, the mother requested for a bigger room. Sabi ko, hindi naman po kailangan kasi 2 days lang. Hindi, mas gusto ko talaga. So nakakuha sila ng bigger room. So when I did their procedure, yun pala, kaya pala gusto ng mother ng bigger room. Kasi during the discharge, dala ang isang barangay na pamilya. Lahat ng kamag-anak nandun. Kasi the patient was so loved and supported by the family. Punong-puno yung room ng mga kamag-anak. Puro kamag-anak lang. But anyway, this kasi autism kasi hindi ko nakukuha ng x-ray yan. So when it comes to the OR yan, surprise talaga. Kung ilan yung tatanggalin mo, hindi mo alam. Kasi hindi sila pwedeng kuhaan dahil ayaw nila na maingay sa x-ray. So for this patient, unfortunately, akala ko harap lang yung problema, no? Yung pala may 3 impacted teeth. The impacted teeth is embedded in the bone. Siguro kahit sa mga regular, alam ko ano yung impacted tooth, nakabaon yan sa buto, and that is really surgery. Now you have to remove the bone, and you have to make a flap, incision, expose the bone, and then remove the bone, expose the tooth. So ayun no, yung isa, impacted teeth. So I did the patient for 4 hours, that long. Kasi nga, 3 yung impacted teeth niya that I need to remove. Kasi hindi, kung hindi tatanggalin, lalo mag-i-infect din yun. So even if the mother only complain, ay kasi may sira siya dito, you see everything na rin that needs treatment or else it will result another problem. Sige, next please. Ito naman, this is a heart patient. The patient is a 3 years old that will undergo open heart surgery. Okay? But this patient, kailangan tanggalin lahat ng sirang ipin or else kasi kapag nag-open heart surgery, kailangan walang cause of infection. And intraoral is the main source of infection. So I need to remove all the caries teeth. So ang tapang ng bata, mag-4 siya actually. So I remove all those teeth. So halos lahat, nawala. So anyway, nakischedule na siya. So choosing between sedation and general anesthesia as part of general management will depend on the oral diagnosis, assessment of the behavior and other medical condition. So behavioral management, good oral hygiene maintenance, periodic recall will depend on the support of the family. It's very important, family support, relatives and caregivers. Next please. Okay, next please. Those are my references. A child with special needs will inspire you to be a special kind of person. And that's very true. To be kind is more important than to be right. Many times what people need is not a brilliant mind, but a mind that speaks with a special heart that listens. With that, thank you very much.